We know Thanksgiving is coming up, and we know that many of you will want to enjoy that with families.
From the upcoming
Also
Thanksgiving
remember
holiday,
that COVID-19 exists in families, in small social circles,
to a drug that
backyards.
was but is no longer leading the way in treatment of COVID-19,
Remdesivir is not living up to our hopes, and it doesn't appear to be worthwhile as far as inpatient people.
to if we'll see compliance officers monitoring the wearing of masks.
Since last Friday, we haven't needed any compliance officers because I have had plenty of people contacting my office telling us about violations.
Members of the city of San Angelo, Tom Green County, Goodfellow Air Force Base, and the local health authority assembled to discuss our area in COVID-19 this afternoon.
I have no desire for anybody to have to close down.
Of the main topics, the new drug to treat COVID-19, bamlanivimab, also known as Bam Bam.
Monoclonal antibody has been shown to decrease the need for hospitalizations if it's given to somebody very early in the course of their disease. It doesn't work, at least it doesn't appear to work, if you give it to somebody who's already hospitalized, because by that time they've already made enough their own antibodies. It doesn't seem to help.
With Pfizer and BioNTech working on a COVID-19 vaccine that, according to officials, is 95% effective in preventing mild to severe cases of this disease, our Joe Hyde asked if a vaccine could be here in time for one of San Angelo's biggest events.
Jacoby, a buckle in San Angelo.
The biggest economic driver of this town is the rodeo in February. So how fast can we get this vaccine distributed and out there where it's having an impact, and perhaps we can have a bigger rodeo than probably what they're planning right now?
I don't think we can do it that fast.
You don't think it's going to help at all?
It's going to help some, but I don't think we'll be able to get everybody done that fast. You don't want me lying to you, right?
With the vaccine out of the equation for the rodeo season, Dr. Vretis gave us a realistic timeline of when we could expect it.
Okay.
February, I don't expect to see a big change by February because it takes a while to actually develop antibodies and stuff after you get the vaccine.
When do you think, if we were to start distributing to healthcare and first responders and things like that in, let's say, January, when do you think this light at the end of the tunnel that we're all seeing, right? This little glimmer of hope?
Oh, I see a glimmer of hope, but it's not for February. I think, maybe April, May, we should be doing significantly better.
Meanwhile, in case you're wondering about a selection of vitamins to take during these COVID times, Dr. Vretis enlightened us.
If you're at home or you haven't gotten the COVID yet,
Yeah.
what vitamins are we supposed to take?
I tell you what I take.
All right, what do you take?
I take zinc every day. I take vitamin C, vitamin D, and multivitamins. I do the gummy multivitamins and just chew a couple of them. It's kind of like a dessert.
For San Angelo Live,
That's all I have. Thank you, sir.
I'm Manny Diaz.